I have very good news today. Our case rates are dropping and our vaccine availability is increasing. Here are the numbers. Since yesterday, we have identified 451 new cases of the coronavirus infection in Philadelphia resident by the PCR test or the antigen test. And for the past week that ended May 1st, by the date in which the sample is collected, we averaged 384 cases per day. Now, so far, we expect more to come in later. And of those people that were tested, 5.0% tested positive. And put that in perspective, the week before, we averaged 478 cases per day, and 6.1% of the people who tested were tested positive. So cases are falling in Philadelphia. They're also falling in the region, and they're falling in the United States as a whole. And they're falling in almost every state in the United States. And back here in Philadelphia, we did identify 15 new deaths from the coronavirus infection since this time yesterday, bringing us to a total of 3,494 deaths total since the beginning of the epidemic. Now, we hit a low of 23 deaths the week of March 21st. That number increased to 60 deaths so far the week of April 11th. Now, these deaths lag behind, so we will likely have 2 to 3 weeks of more than 50 deaths per week before we start to see a decrease in deaths. Let me turn to vaccination. We're making progress. Our weekly vaccinations are decreasing, but the numbers that we're vaccinating each week is still very large. To give you the sense of this, for the week ending April 18th, there were 112,000 total doses administered across all providers across the entire city. Week ending April 24th, that number went to 85,000 doses administered. And last week, so far, we know 52,000 doses administered. We expect that number to increase with late reporting. Now, most of this decrease is from the large mass clinic sites, Convention Center and Esperanza. Vaccinations in pharmacies and in hospitals and neighborhood clinics have not decreased so much, which is a sign that the remaining people, the ones who are not vaccinated yet, want convenience and want to have sites that are closer to home. Now, as of Monday evening, we had logged in a total of 779,000 people who received one or more doses, and 524,000 people who were fully vaccinated as a result of the efforts of all the Philadelphia vaccine providers. If you want to know how many people in the city of Philadelphia are vaccinated, you have to go to data from the CDC because of the people that were vaccinated outside the city. By their statistics, 36% of those over the age of 18 are now fully vaccinated among Philadelphia residents, and 59% of people over the age of 65 are now fully vaccinated. That's good, but we still have a ways to go. Now, the availability of vaccinations in the city continues to increase. We now have 282 sites that are enrolled in receiving vaccine. That's up 7 since last week. And we have our 52 independent pharmacies that are now enrolled. Now, as for our 2 large federally supported sites, the Convention Center administered about 1,100 doses on Saturday and about 500 doses on Saturday. They've been using the Pfizer vaccine and delivering the first doses of the 2-dose series. Now, as a pilot, on Saturday, they added Johnson & Johnson vaccine as an option. And about 300 people came there and chose that Johnson & Johnson vaccine. The vaccine was available again on Sunday. Now, we'll be switching to the second dose of Pfizer tomorrow, and initially we expect to see large numbers of people based on how many people got their first dose there 3 weeks ago. But we'll be continuing with the second doses of Pfizer, and then as of May 11th, we'll be adding Johnson & Johnson as an option, and that'll continue through May 25th, which is the last date in which that clinic will be open. Now, the Esperanza site delivered about 400 doses of vaccine on Saturday and about 300 on Sunday. That will switch to the second dose of the Pfizer vaccine tomorrow, and it will continue with the second dose of Pfizer vaccine, but we'll also continue to take people who are coming in to start their series with their first doses. They'll do that through May 25th. And for those people who got their first doses between then and May 25th, they'll get their second doses administered to them through our neighborhood clinics. Let me talk a minute about our city-run neighborhood clinics. We continue to do about 1 or 2 per day in different areas of the city. In particular, the fire department-run clinics that use the Johnson & Johnson vaccine were restarted last week, and they will continue. All of these sites are taking walk-ins as well as people by appointment. And we're working to increase the number of these smaller neighborhood-based clinics to give people the convenience that they want in order to be vaccinated. Let me talk for a minute about children. As you probably heard, the Pfizer vaccine is likely to be approved within a week or so for children down to the age of 12. That means here in Philadelphia, there'll be about 80,000 newly eligible children. We want all those children to begin to be vaccinated before school starts again in the fall. Vaccine for these children will be offered at existing sites, hospitals and pharmacies and clinics. And in addition, we will be enrolling pediatric providers. The number of pediatric providers will be limited because this is the Pfizer vaccine, which is the most inconvenient to use. It needs the ultra cold storage. It comes in trays of 1,100 doses. So it's going to be a little more complicated to supply the pediatric providers, but nonetheless, we will have some pediatric providers who will be available. If you are a parent of a child between the ages of 12 and 15, plan to go with them to an existing site when this vaccine is approved. And if you aren't vaccinated yet, while you're there, go get yourself vaccinated at the same time. Now, where should you go? Just remind you that finding and scheduling appointments is easy now. It's easier than it's ever been. You can go to www.phila.gov/COVID, click on Get an Appointment on the red banner. Page will show up. If you click COVID-19 vaccination, you'll see a list of city-run sites with maps and hours, the vaccines used, and the appointments available, and you can schedule yourself an appointment. There's also a new federal website that was started up, www.vaccines.gov, which will search the commercial vaccine providers, like pharmacies and clinics. And there are links in that site to the sites of those providers so you can schedule yourself an appointment. All these sites increasingly do accept walk-ins, even if they don't necessarily advertise the fact that they take walk-ins. Now let me turn to our social distancing restrictions. And this epidemic wave that we're in now is clearly on the decline. And so, as I said last week, we are backing off on our restrictions. Effective this Friday, May 7th, restaurants indoors can go to 50% capacity or 75% capacity if they meet our enhanced ventilation standards. They still need to have a minimum of 6-foot distance from chair back to chair back, though. Catered events indoors can restart up to 25% occupancy with a cap of 75 people, again, effective this Friday, May 7th. And if case rates continue to fall, we'll increase that cap to 150 people as of May 21st. We still do encourage people to have their social events outdoors where the ventilation is much greater and it's much safer. Other gatherings events are capped at 25% capacity indoors and 50% capacity outdoors. And I do want to issue again the strong recommendation I made last week. Anyone participating in these higher risk, higher density activities should be vaccinated first. Now, as you probably heard, New Jersey announced yesterday that it'll be reducing many of its restrictions effective May 19th. But if you look closely, they still have many limits, including maintaining a 6-foot distance for most gatherings and a 30% maximum capacity for indoor large venues. And then just shortly earlier today, Pennsylvania announced that it'll remove all of its restrictions except for the mask mandate effective May 31st. And we're going to review the New Jersey policy and the Pennsylvania policy, and we'll consider our local policy in the light of that. We'll announce that later. We won't have any other changes to announce today. But I do want to issue this warning. Everyone wants this epidemic to end, but this epidemic is not over yet. We have more than 100 people being hospitalized and 50 people dying every week now. We're making great strides, but only about a third of adults are fully vaccinated. Now, this epidemic has unfolded in a series of waves. And it's good to see this particular wave receding, but we're still right now vulnerable to future waves of the epidemic. And I don't want to see anyone die unnecessarily. So what should everyone do? Get vaccinated, number one. But just remind you that Mother's Day is this weekend. And so before your family get together, give your mother the best gift ever. Help her get vaccinated if she's not already vaccinated. Get vaccinated yourself and get every other relative vaccinated as well so that she's still here to celebrate again next year. And continue to wear your mask. All this information is on our website, www.phila.gov/COVID. Thanks.
Hello, everyone. Good afternoon. Armando, buenas tardes. La primera pregunta es, ¿alrededor de cuántas vacunas Pfizer está recibiendo la ciudad? Y ese número podría incrementar si es que la FDA le da la aprobación a Pfizer para vacunar a niños de 12 a 15 años?
The first question is probably for Commissioner Farley. How many doses of the vaccine, of the Pfizer vaccine, is the city getting? And since FDA is considering, and actually should be the CDC is considering vaccinating 12 to 15-year-olds would that number be increased?
We are receiving between the first doses and second doses about 40,000 doses per week of the Pfizer vaccine. And as I said, there will be about 80,000 children between the ages of 12 and 15 that will be newly eligible when the vaccine gets approved. But we don't need to vaccinate them all in 1 week. We have some time to do that. So I do think we have adequate vaccine.
Nosotros estamos recibiendo actualmente entre la primera y segunda dosis de la vacuna de Pfizer aproximadamente 40,000 dosis por semana. Y obviamente si se aprueba la vacunación para los niños o los adolescentes entre los 12 y 15 años de edad, vamos a tener 80,000 niños elegibles en la ciudad. Pero obviamente no tienen que vacunarse todos en la primera semana o en una sola semana. Nosotros contamos con las vacunas necesarias para poder cumplir con esto.
La segunda pregunta, Armando, es, ¿pudiera tornarse obligatorio que los niños se tengan que vacunar antes de que empiece el próximo año escolar? Y al mismo tiempo, ¿cuál es el mensaje para padres que todavía están o tienen un poco de miedo vacunarse ellos mismos y ahora vacunar a sus hijos?
It's a two-part question also for Commissioner Farley. Will it become mandatory to have children vaccinated before the beginning of the next school year? And what would be the message for the parents who are reluctant to vaccinate themselves and now their children?
At the moment, we're not issuing a mandate and not considering a mandate for children to go back into school, but it's certainly a strong recommendation. And if parents are concerned about the vaccine, I would say that this vaccine has been tested in children, found to have no adverse effects whatsoever. And actually, the children had a better response to the vaccine even than adults. They were almost 100% protected.
Nosotros por el momento no tenemos ningún plan de hacer obligatorio el que los chicos se vacunen antes de regresar a la escuela. No lo consideramos un mandato, sin embargo, es una recomendación bastante fuerte que estamos recibiendo nosotros y lo vamos a considerar. Pero quería recalcar de que esta vacuna aplicada a los niños ha resultado dar mejores resultados que con los adultos. Han logrado una cobertura de protección de casi al 100% sin efectos adversos como se ha visto en la gente mayor. Gracias.
Y por último, ¿cómo esta vacuna va a ayudar a alcanzar la inmunidad comunitaria acá en Filadelfia?
The last question also for Commissioner Farley. How will this vaccine help us achieve herd immunity here in Philadelphia?
The more people that we have vaccinated, the lower the community rates overall. And so we can get those 80,000 children vaccinated, that'll help protect everyone.
Mientras más gente se vacune, más baja va a ser nuestra exposición y si podemos lograr que estos 80,000 niños se vacunen, probablemente lleguemos a conseguirlo. Gracias.
Gracias, Armando.
Por nada.
Okay, next up we have Kennedy Rose with the Philadelphia Business Journal.
Hi, my first question is for Dr. Farley. Dr. Farley, I was wondering, do you have any concern about... Do you have any concerns about New Jersey and Pennsylvania's impending reopenings, especially as thousands of workers come into the city from the suburbs?
I am just in general concerned about restarting high-risk activities too soon. We have many cases of infection occurring right now, and not enough people are vaccinated to protect those people. So I certainly hope that people, even if they are allowed to restart certain activities, that they be careful about it. And if they're engaging in high-risk activities, be vaccinated first.
Okay. And I was wondering, have you expressed any of your concerns to Governor Murphy or Governor Wolf's offices as a result of these new announcements?
No, I talk regularly to the people at the State Health Department of Pennsylvania, not so frequently to the people in New Jersey. And we talk in general about strategy, and they understand the trade-offs.
Okay. And my last question is also for you. I was wondering how you felt about Governor Wolf's new order to kill the mask mandate once 70% of adults are vaccinated. How do you feel about that?
Well, I don't know that it'll be a while, I believe, before in Philadelphia, we have 70% of people who are protected. I hope we get to that point. And I think we should defer that decision until we get to that point to see what the epidemic is doing here in Philadelphia.
Okay, super quick follow-up. Do you think it's enough to get to 70%? Before killing the mask mandate?
Experts on this really can't give you a single threshold to say beyond that we won't, if that many people are vaccinated, we won't see transmission. So I think as we approach that 70% or some number around there, we'll have to see what's happening to the epidemic and make a judgment call at that time. You know, a mask is a very easy thing to wear. And I don't think a mask mandate is overly burdensome on people. And if that saves lives, I'd rather be on the safe side and have people to wear masks longer than is necessary than to stop using them too soon.
Okay, thanks so much.
Thanks, Kennedy. Next up, we have David Malandra from Philly Sports Network.
My question is for Dr. Farley. Has there been any follow-up updates about the original complaint you received about the masks not being worn in Citizens Bank Park?
So we communicated with the Phillies, and they said that they were going to be more careful about enforcing it.
And you said as of May 7th, the stadiums in Philadelphia can go 50% capacity. Do you think it's too soon for that to go 50%, or do you think this is the right time to do it?
So that's 50% capacity, but they still need to maintain the 6-foot distance. And so that probably means that they will not actually be able to reach 50% capacity in that particular stadium, probably something less than that. Now with the governor's order, that frees up some opportunities. And we'll have to see, what point that may be appropriate to go to more than, right now they could probably do about 30%, given their layout, if they maintain a 6-foot distance. And we'll see about when it might be appropriate to increase that percentage.
And my final one for you and for Mayor Kenny, what are your thoughts about the governor saying May 31st, all the restrictions would get lifted? And do you potentially see 100% capacity for, like, say, for a football stadium in September?
September is too far off. I'm not willing to make any prediction as to where we'll be in September. And I would just say what I said earlier, the epidemic is not over yet. We need to be careful. Where this particular wave is out in the decline. It's a good thing, but we're still vulnerable to future waves, and so we need to be very careful.
Mayor Kenny, your response?
I mean, we've come this far by following the science. I recognize the political pressure on people and the economic pressure, but there's no sense in coming this far and then loosening to the point where we slide back. So I'm hoping September will be, all restrictions gone. But again, the press continues to ask, that's nothing personal, but the press continues to keep on asking for us to predict what we don't know. I don't know. We're hopeful and we'll see how it goes. And case counts are going down, and hopefully they'll continue going down, and we'll get back to some normalcy, but just keep praying and hoping.
All right, thank you.
Thanks, David. Next up, we have Martin Pratt with Philly Your Black News.
This question is for Dr. Farley. Dr. Farley, can you explain, there seems to be some confusion around the concept of herd immunity. And from New York Times article yesterday, several doctors said that the United States is very unlikely in the U.S. that we will reach herd immunity. Is that a statistic or a level that we should be thinking about going forward?
Now, the concept comes from where you have a closed population, like a herd of cattle. You don't need to vaccinate 100% of the cattle to prevent an infection that is spread from one cow to another from spreading in the herd. But this is a giant country of over 300 million people, and there are many different settings within that country. So there isn't any percentage number for the country or even the state or the city that can guarantee that we will not have any virus spreading. And so I think it's actually not a useful concept right now. I think we should just simply, and I think the New York Times article was accurate in saying that, we should simply view that the greater the percentage of people who have vaccinated, the lower the case rates will be, and we want that to be as high as possible. There's no magic number, and the virus will not be eradicated from this country or this city anytime soon. And so people should not assume once we hit a certain number, we can give up. We're going to have to maintain a variety of efforts to keep it from becoming too much of a problem for at least a year.
Second question is, thank you for that. Second question is, due to the high pollen this season, has the sinus infections and sinuses issues, has it affected the amount of people in the hospitals?
Don't think so, no. We don't track, most people aren't hospitalized for allergic type problems, and we don't track that. The pollen count is high this year, but there's a peak every year. So I think it's probably no different from previous years, but we don't have any numbers on it.
Thank you.
Thanks, Martin. Now we'll go to Jack Tomczuk with Metro.
Thank you. This is for Dr. Farley. So, in looking at whether to pull back most restrictions or all restrictions, what factors are you looking at when you're thinking about that?
Looking at our case counts, looking at number of people hospitalized, number of people die, and we're looking at our vaccination coverage overall and in people over 65 who are the most vulnerable.
Okay, and so, but there's no particular number that you're looking to reach for that? Like, the governor put out the 70%. I mean, is there any particular number when you're thinking about percent vaccinated?
No, as I was saying earlier, there's no magic number. We want that vaccine percentage to be as high as possible. We're a long way away from 70% right now.
All right, thank you.
Okay, next up we have Jason Lachlan with the Philadelphia Inquirer.
Hi, Doctor. Having gone over to the convention center in Esperanza recently, I've talked to some people that have been really surprised by the lack of demand there since you reached full eligibility for adults in the city. What do you make of the numbers you're seeing and why they're so low at these clinics, and then to some extent throughout the city where vaccination overall is down?
Well, overall, the people who were most eager to be vaccinated have been vaccinated. Now we're getting into a fairly large group of people who are maybe ambivalent about it or a little bit reluctant, or simply they got many other things going on in their lives that's just simply not important. And those people are less likely to go to the trouble of traveling to the convention center to be vaccinated. But we do think we can get many of those people vaccinated by simply making it convenient for them. So wherever they are, they can get it done in 15 minutes, they'll get it done. So that's where we're changing our strategy. And we see that in the statistics that the clinics that are in neighborhoods, that the clinics that are in the services in pharmacies, and to a lesser extent in hospitals are maintaining a pretty good volume. People are continuing to go to those, but they're not going to ones that are just somewhat more inconvenient. So we are changing our strategy to make it as convenient as possible.
Is there any chance of diverting doses that you would have been sending to the convention center out of the Philadelphia supply and sending them to some other locations?
That has not been requested of us. In general, in this country, there now is more vaccine than there are people who are going in to get vaccine. So there isn't a demand for it in other parts of the country. And I'm not aware of any plan to have doses that are not used in this country to go to other countries.
Sorry, I meant to other locations within the city. The doses that would have gone to the convention center, maybe sending them to other clinics or elsewhere within the city.
We have adequate doses for any provider in the city right now. Any provider requests vaccine, we have adequate doses. So there's really no need to somehow divert doses that were going to be at the convention center.
Okay, and last question. I was looking at the data on seniors, and I saw 65 to 74 and 75 and up are both over 50% right now, but are still not climbing as they had been. What's the strategy to try to reach out to some of those seniors at this point in the city?
Well, we've been working to try to reach seniors for months now, and it involves phone calling. It involves the phone calling by like the Philadelphia Corporation for the Aging, as well as health plans. We also have teams going to facilities where there are a lot of seniors, or say a housing complex that has a lot of seniors. And we are increasing our activities for people who are homebound and can't get into a site at all. So we're going to just continue to do that. And I do think it's going to take weeks or months for us to get a high level at the population. It's a very important population to us.
Thank you.
All right, thanks, Jason. Next, we have Denise Clay Murray with the Philadelphia Sunday Sun.
Yes, good afternoon, everyone. I'm not 100% sure if this is a COVID question, but since we're talking about reopening things, I figured that it might be something I could ask. There's been discussion about I guess the stadiums and other places that are going to be opening up to most capacity. Has there been any decision made on Welcome America yet? Usually around this time, we're hearing something about Welcome America, who's appearing, or whatever. Has there been any decision made on Welcome America yet?
I'll simply say that we are in discussions with WAWA Welcome America about any activities they're taking place being as safe as possible.
Okay.
Yeah, that's mostly what I was going to say as well, Mayor.